I'd like to invite all panelists to switch their cameras on now, please, if that's okay. Hello, Mark. Good to see you. Hi, Naomi. And there's Rukhsana there, and let me just see if we got, and Susanna is there too. That's great. So we've already introduced Andy, of course, and Rukhsana, but if I can just introduce our other panelists before we get started. So Dr. Mark Turner is, if you like, Rukhsana's equivalent in the adult dermatology service. He's since 2014 been working full-time with the adult medical dermatology multidisciplinary teams, not just on eczema, but also psoriasis, hidradenitis suppurativa, which is a relatively rare but highly disabling condition where people develop large pustules, acne-like lesions under the arms and the groin area, and vitiligo, so a disorder of pigmentation. Mark is very research active. He does a lot of lecturing for King's College London, and he was also part of the all-party parliamentary group on skin report, mental health and skin disease, which is published in 2020. It's a great pleasure also to introduce Dr. Susanna Barron. She's my dear consultant dermatology colleague from St. John's Institute of Dermatology. Susanna is part of our pediatric severe eczema clinic. Whenever I have a patient where we have difficulty with what Rukhsana was talking about, Susanna and Rukhsana are the people to turn to. So I'm very grateful to have them in our team. Susanna also set up a multidisciplinary pediatric psychodermatology service at St. Thomas's. So this is psychological distress associated with skin disease in general. Susanna is very research active, so working on our research program with my team, and then she's also chair of Psychodermatology UK. And then last but not least, Dr. Naomi Camp is a general practitioner and a GP with an extended role in dermatology, based in South London with many years experience. She's on the Southeast London Area Prescribing Committee for Dermatology and also co-chairs the National Dermatology GP with an extended role accreditation program. So welcome to you all. Thank you very much for joining us. I think Rukhsana, I'll come to you first, if that's okay. You gave a great, very practical talk and quite a few questions there. One of the things that you didn't really have much time to talk about is habit reversal. You gave you said there's a book available. Do you mind just very briefly? I know it's a big topic and you're working with Susanna on a research project called Kids in Control as well. But you know, if you just say a little bit more about that, what does that actually mean, and how would people get into habit reversal if they're not lucky enough to meet you in clinic?
So habit reversal often refers to where people about breaking the itch scratch cycle. So often the itch scratch cycle can become a bit of a habitual response. And over time, people might use it in response to stress or anxiety or other things. So the idea is to teach people ways of almost breaking that cycle, either using a competing response or other strategies. But also the way that Susanna and I work is that we've broadened this a bit more to think about actually the context and what is it that triggers that itch scratch cycle when a person's engaging in it. So that's what we're partly looking at. And in terms of if you really can't get access to a psychologist in dermatology, or your CNS team, a specialist nursing team, aren't trained in habit reversal, or you don't have dermatologists with an interest in it, Dr. Chris Bridget has a really helpful website, Atopic Skin Disease, that has lots of really useful resources, and he is the forefather of habit reversal and created the original protocol. Like I said, that book by Sue Armstrong Brown is a self-help book, so it can be also really, really helpful. But also often I'll tell people to think about the ABCs. So what is it that triggered off your itch, your scratching, your antecedent? When you scratch, what happens then? How do you feel? And what's the consequence? So is it that you feel relief? Is it that you feel shame? And to almost break those up and be a bit of your own detective, to think about, right, when I'm alone in my bedroom, that's when I'll have a good scratch and then I'll feel relief. Or if I've had a hard day at work, I'll have a good scratch and then I'll feel better. So again, breaking that down and thinking, what else could I be doing? Susanna or Mark, would you like to add anything?
Mark, do you want to come in? Yeah.
Sure. So yeah, so habit reversal is a technique used often, and it has a good research base for being added to use of topical treatments to improve eczema more significantly so than topical treatments alone. And the first week of the treatment includes monitoring scratching. Actually, this isn't a setup. I didn't realize I had one, but I've got a little scratch monitor here. Got a hand tally counter, so you can get these on Amazon. And for 1 week, every time you scratch, you click, or if you scratch with 2 hands, you click twice. And you also monitor, okay, during this first week, where did I find myself scratching? What situations? So as Ruxana said, what context, did you find yourself clicking in? And then after that first week, you come back, hopefully see your therapist or continue with the next chapter of the Eczema Solution by Sue Armstrong Brown. And you add in a competing response, which is the classic one is just sort of holding your fist like this. And then if after 30 seconds you still want to scratch, you just gently poke the area on your skin where you wanted to scratch, and then keep your hands busy and do something else whilst you continue to use your clicker to monitor your scratch counts. And often what happens is that those scratch counts come down, and people find that it can help improve their eczema severity, which is then encouragement in itself to continue using habit reversal and to reduce scratching as your skin improves.
Thanks, Mark. No, that's very helpful. Susanna, can I move on to you? So there is a question around mindfulness. What is mindfulness, and how can I learn to practice mindfulness? Is there something that people, again, is about, just the distance to a sort of an expert clinical psychologist or consultant like you? Is there something that can be done maybe online, for instance, or yeah?
So, I mean, mindfulness has been around for a very, very, very long time. And it's really about paying attention to what's happening in the moment, and being aware of it without judgment. And it's the without judgment that's really important. And that goes back to, Ruxana's great talk, because all of us often carry around that sort of negative voice in our head. So, and instead of sort of trying to tell yourself maybe to stop scratching, it's just being aware that your skin is itchy. And it's that awareness of the conditions around. And we're really fortunate now that there's lots and lots of apps that are available for mindfulness. And my head has completely gone. What's that? What's the one, Ruxana? What's it called?
Headspace.
Headspace is a great app. There's a lot that you can have available for free, and it really explains it. And it starts off with these lovely little cartoons, and it's almost like you're standing by the side of the road, and it's very difficult to calm your brain down. It's almost like you're seeing your thoughts going backwards and forwards like cars, and it helps you to go back to your breathing. It's also got lots of apps that are suitable for children and young people, and there's specific ones that can help with sleep. So you can use it for different parts, and it depends what the person really wants help with, whether it's sleep, whether it's maybe reducing scratching, whether it's because we all know that if you get anxious and stressed, which we all have in our lives, that often makes your eczema worse, and then that gets into a vicious cycle, because you get stressed, your skin gets worse, then it becomes visible, then you get more stress, then the itch scratch cycle goes. So having that Headspace app or other apps could be great, because you can just do a few minutes a day, which is quite practical. You can do them on the train, on the bus, all of those sorts of things. And once you've got those skills, you can use it in the moment. So if you're in a stressful situation, say, I don't know, at work or in a difficult meeting, and you can feel your skin getting hot, then you can just go back to your breathing and use some of those techniques, because they're very, very portable. Anything you want to add to that, Ruxana?
No, that's very useful. And so using a phone app, and even if it's just a few minutes a day, it clearly can be really helpful. But Susanna, probably more research needed. Would be good testing something like this in a clinical trial situation as well, isn't it?
Yes, absolutely. I mean, they've done some very
Yeah.
interesting research on mindfulness, and actually just doing an 8-week program of mindfulness can actually show changes in parts of your brain, in your amygdala. So the mindfulness is a very interesting, so it's had a lot of research with it, but not specifically eczema.
Eczema.
I
Yeah.
was going to just add, Andrew Thompson over in Cardiff has done some research around mindfulness in eczema. So he's done some good studies showing the efficacy in terms of just reducing that stress response and then that improved skin result.
Naomi, can I bring you in? So you work in primary care, and a lot of pressures, time pressures in particular. You've got very short appointments, and yet you recognize very well as a GP with a special interest in dermatology how complex, as Andy was saying, eczema is, and how many layers there are. There's the psychological side, there is obviously the skin inflammation and practical management side of emollients and anti-inflammatory creams and so on. What would be your approach in primary care when it comes to the sort of psychological problems, the mental health side of eczema? Is there something that, again, that can be done within the confines of primary care? How would you approach that in your setting?
Thank you. I think some of it is what you've all been talking about, which is taking time to listen and find out what's really going on, and being reminded again about the importance of sleep, actually tackling symptomatology so that people can sleep, thinking about the family, the broader family. I think it is where we try and start, and actually also making sure I've booked a follow-up appointment, because although these times are short, we can have continuity, and as GPs we can do that, and try and make sure that our team do the same, trying to make sure also that we're giving you and parents enough of what is needed to control symptoms, so that side of things is easier. It's, I think, really useful to hear from Rukhsana about the work with kids about habit reversal and thinking about how you can try and bring that, because parents are really wanting to introduce that into daily routines. So I think that's where I start.
Rukhsana, I wonder, and so with your role within the Primary Care Dermatology Society, Naomi, is potentially, doing a webinar like this for general practitioners around some of these relatively simple techniques at the national level would be quite useful. I know GPs have to cater for all conditions, but given that dermatology, skin disease, in particular eczema, about a quarter of all GP consultations, having some maybe basic skills around that might be welcome.
I think there'd be great enthusiasm for that, both on the part of healthcare professionals in the wider sense, actually, because we have pharmacists, paramedics, physicians associates involved as well, and they're often at the coalface. So I'm sure that we can talk more about that.
Yeah, that'd be great. Andy, I mean, such strong messages from your survey, and I suspect, so when your helpline is rung, there are a lot of people in a lot of distress, and they bring up their mental health concerns with eczema. What are the resources that the National Eczema Society has got available, and how does your very experienced team deal with that when they get a call from someone who is in a lot of distress, might have depression, anxiety, is asking about coping strategies?
Yes, I think we have a helpline service, and when people call, a good proportion of those will either say they're struggling, or just from the course of the conversation, you'll appreciate they're struggling, and we obviously get through emails and messages as well through social media. But I think the thing is that people need to almost talk about it to be able to process it themselves and understand that, and almost validate things for them, because when you have a long-term condition like eczema, you just get worn down by it, and people just don't understand how low they can get, and then how and what might be available to help them. And I think what we try and do is try and give at least something that will move it forward, and sometimes that's giving people confidence to go to the GP and just say, look, I'm feeling really, really low with this, I just need to find some way of improving things, or I've not slept properly for 4 weeks and I'm at my wit's end. And it's because you cope with something when it's a long-term condition, often you just find ways and means of coping, but often struggle along the way. And I think part of what we do is trying to help people understand that there is help out there. And we've just heard about some fantastic resources today. And there are these talking therapies that are available on the NHS. Not always easy to access, but they are there, and some of them are fabulous. And actually, we speak to a lot of people who've had some transformational change by going through, by having one of these talking therapies. Susanna said, you know, you can make a big change in 8 weeks. And bear in mind, people have struggled with eczema often for years and years. That's not a big investment to try and, you know, really move things along.
Yeah, thank you. There's a question maybe that I can field. You talk about the effect of eczema on the mind, but please, can you tell us more about the effect of the mind on the skin? So I was showing this figure of where it's not just from the skin to the brain, but from the brain to the skin as well. So you have that. I was talking about the tree with the branches, and that the branches are developing more and more smaller branches, tentacles, and the sensory nerves are becoming increasingly sensitive, and sometimes people then experiencing pain and itching. Now, if you have skin inflammation like that, and you have very severe itching, and you're scratching yourself all the time and you can't sleep, that is a form of torture and severe stress. And that sort of severe stress sends direct signals from the brain through the spinal cord into the skin that upregulates the inflammation and all the chemical cascades that are going on in the eczema. So there's a direct feedback, negative feedback loop from your mind and your brain back into the skin, amplifying the whole process. And it's you know, you have that contributes hugely to that vicious cycle. Hope that maybe makes it a little bit clearer. Susanna, I know you had a strong interest, and may still have, in hypnotherapy. So not surprisingly, a question: is there any evidence that hypnotherapy can help reduce the urge to itch?
So there is a lot of evidence with hypnotherapy in other conditions, particularly irritable bowel syndrome. And I did some research myself looking at hypnotherapy with adults and children with severe eczema. And it's particularly good and helpful for breaking that habit of scratching. Because we know how difficult that can be, because lots of people with eczema are not even aware when they scratch. And you showed that really profound video earlier on of that poor child scratching in their sleep. So what can be very helpful with hypnotherapy is helping to break that habit of the scratching. And it's also very useful in reducing stress and helping people manage the stressfulness of life, and it can be very calming. And what was helpful with the irritable bowel syndrome work, which has been shown, is that it's as effective in a group as it is individually. So I think there's lots of now guided meditations and things that you can find online, particularly helpful for sleep, that people may find helpful. But I would recommend that if you do want to go through the hypnotherapy line, that you try and find a practitioner that's used to helping with skin, because when I trained, there wasn't really any, there was very little done within skin. So I sort of worked out what I felt would work with people. So find somebody that is used to working with people with inflamed skin, but it can be very helpful for symptom control, very helpful for cooling the skin, very helpful for sleep, and helpful for breaking that itch scratch cycle.
Great, thank you for that, Susanna. Mark, maybe, so second last question to you, and then I'll briefly talk about the gut brain skin axis as well. This is a question around suicidal ideation, thoughts of and you know, self-harm. Is it something which is observed as transient or reoccurring in patients, perhaps coming back with disease flares?
Good question. There is some research showing that as eczema severity increases, depression also increases. So there will be lots of people where if their eczema is more severe, or if their skin is flaring, they might be more likely to feel depressed about their eczema, or they might be more likely to have suicidal thoughts. But it is important to remember that people can have all sorts of triggers to what their suicidal ideation. And if you do get the chance to have an assessment with a psychologist or a cognitive behavioral therapist in a primary care psychology service, this is something to talk about, and to think about what your triggers are, and to get help with that, and also to know what your sort of management plan would be if that escalates, and to understand that, for example, you can call the Samaritans, and even going to A&E is a place of safety if you start to feel unsafe with your suicidal thoughts. And we know that other feelings such as anxiety are less likely to correlate with eczema severity. So again, sort of seeing a psychologist or a cognitive behavioral therapist for support around your feelings, no matter if the trigger is your eczema or otherwise, can be important for sort of holistic care of your skin and quality of life.
Yeah, thank you. That's great. And so very good point made by Caitlin Bodfish here, right at the end. She's posting, we know emotional well-being can drive eczema to such a great extent, but most dermatologists don't even mention it. So Naomi, I didn't want to get at you as a GP. I'm not saying dermatologists are better at all at managing these things, and that includes me as a dermatologist. I think we as a healthcare profession, unless we're really lucky to have Rukhsana and Mark around, you know, we need to learn more about this, and there's a lot of training that needs to be done in the medical profession to for dermatologists, allergists, pediatricians to be more aware of this profound impact that eczema have on emotional well-being, and at least to be able to field some of the concerns from patients and give them some good advice along the lines of what Rukhsana has said. And there is some good online sort of program now as well from the University of Southampton, which we can send you a link to, as well as sending you a QR code to the Mind and Skin program. We'll send you after the event today a link to all the resources from Rukhsana Ali and the book as well, Rukhsana. People are very interested in that book that you mentioned as well. We're 2 minutes past 7, so I'd like to wrap things up. We've had a great event. A big thank you to the panelists. Rukhsana covered a lot of ground, from practical advice, sort of highlighting the importance there of mental well-being. I gave a brief introduction to our Mind and Skin research program, so do get in touch with Shauna Cameron if your child is interested in taking part. You heard about the National Eczema Society's good work, the survey that Andy presented, the big messages there, and we had a good opportunity to field your excellent questions. I'm sorry we weren't able to answer all of them. I still hope you found this event useful. A special thank you to Sarah Drummond and Alison Sears, who has always have kept us going and have held everything together backstage from the Derm Academy team. Please provide your feedback when you receive the survey link by email, and share your ideas for future topics. Andy, maybe we'll do something similar next year on a different topic. No pressure there. Any further questions or concerned about eczema, you can contact the National Eczema Support Helpline. And please consider making a donation to the NES. Well, we hope to see you again at a future patient public event in collaboration with the National Eczema Society. That's all from me. Have a good evening. Bye for now.